Dan, so tell us about Heartbeat and kind of where you guys fit in the Publicis group, and more widely how you define the agency and sort of what your unique value proposition is.
Sure. Yeah. One of my favorite topics to talk about. So Heartbeat is one of the agencies that's a part of the Publicis Health network, and Publicis Health, of course, is a part of the Publicis group. We like to think of ourselves as an agency for challenger brands. A challenger brand is someone who, maybe they're the 11th drug to launch in a category, or maybe their MOA is one that's going to be totally new to physicians, and they want to kind of upset longstanding treatment habits. But kind of the common thing about all challenger brands is that they might have constrained resources, but they do not have constrained ambition. So those are the clients that we love to work with, big thinkers, aggressive thinkers, those that really want to change the game. And so we help them to achieve their business goals through what we call a 100% integrated model, which means that, the kind of core capabilities of strategy, creative, and media or engagement are all kind of at this, have a seat at the table from the very first discussions of how we're going to help a brand achieve their business goals. So my role as the head of engagement strategy, we're trying to map out all the potential touch points that a brand might have with their targeted audience, whether they're paid, earned, owned, and try to figure out kind of what is the path of least resistance to engaging that audience such that they kind of take the desired action that we want them to take.
So it's a little akin to the DTC companies, maybe. Well, it's not exactly DTC, but challenger brands. How are they? We could go on for a long time, but how are they? How is the strategy? If you could pull any generalities, how is the strategy different for the challenger brands that you work with and the big pharma giants?
Yeah, so it's funny. My background is in paid media, and I feel like I always had a dream that I would work on a $400 million campaign one day, and $400 million campaigns in healthcare are common. And I think that's kind of the route that the big pharma companies typically take is, let's not solve this problem with a scalpel, let's solve it with a baseball bat. And so they're out there spending as much as they possibly can on very broadly targeted media placements, television, print. That's your traditional pharma media mix, is like 75% on television, 24% on print, and maybe 1% on digital or out of home or experiential, or any of the other much more trackable, much more optimizable channels that they have at their fingertips. And so challenger brands don't have the $500 million budget. They need to do more with less. They need to make sure that every dollar is tracked meticulously, that every dollar is optimized meticulously. And really, that's where the earned and owned opportunities for engagement really matter even more. Because if you can generate, the impact of $5 with $1 of investment, that's going to benefit somebody that has a limited budget much more so than somebody has all the money in the world to spend.
Dan, it's a very dynamic period in healthcare marketing. I mean, it's been a very hot sector for a while, and certainly COVID has accelerated things. Tell us about how COVID-related marketing, the challenges have helped your clients sort of navigate through where media consumption is changing, the messages that you're trying to get out are changing. Give us kind of an overview on your activations, the way you've responded, and meeting the expectations of pharma clients.
Sure. Yeah, it's been a really interesting year, obviously a really challenging year for a lot of folks. Healthcare has been, there's been a tremendous amount of activity in healthcare. And it's been, The changes have been just in the way of doing business and kind of pivoting to away from channels that have historically been really utilized by healthcare companies to communicate with their customers. So, for example, we reach two main types of audiences: professional and consumer. For professional audiences, doctors, nurses, the main communication channels have traditionally been the sales force and medical conferences, are two of the big ones. And both of those basically were eliminated overnight. Nobody wants to have people into their doctor's offices if they're open. Conferences are pretty much canceled throughout the entire year everywhere in the world. So our clients have really been looking at us to try to create digital opportunities or non-personal opportunities that try to approximate some of the impact that they may have had with the sales force and with conferences. So, there have been a tremendous number of things. We've been really looking into trying to create new ways of quote unquote e-detailing physicians. So presenting them with non-personal opportunities to engage with the same kind of content that a sales rep might be going into their office with. So that's been a big kind of topic of thought and conversation for us. On the patient side of things, it's really been about how do we pivot our understanding of point of care advertising and how do we start to enter the world of telehealth. For a while there, we were seeing doctor visitation down, depending on what therapeutic category, down 75, 85, 90%, in the height of the pandemic, kind of late spring, early summer. And so a lot of our clients have millions of dollars invested in point of care advertising that nobody was seeing. So first thing is we renegotiated all those buys to make sure that we could track the actual foot traffic in those offices and only pay for what the value we were actually getting. And then number two, telehealth started to be something that everybody wanted to know about. Everybody wanted to have placements that intersected. So we started mapping out that space and started following who the players were that were offering advertising opportunities within telehealth interactions. So it's been really dynamic. We've had to pivot a lot, but I think luckily an agency like Heartbeat is really well suited to be able to, come up with new big ideas when faced with these kind of challenges.
So we hear a lot about CTV and sort of television consumption changing. How are you guys sort of approaching kind of a consumer world that's really, has changed both in reaching docs and in reaching consumers?
As it relates to video, I would classify connected TV, addressable TV broadcasts, online video, these are all channels that utilize video assets. Overall, we've seen consumption go up, regardless of the medium. Video is one of the content formats that has been really ramped up in terms of consumption. And really, anytime you have increased consumption and a more kind of captive audience, in this case, almost quite literally a captive audience, people kind of trapped in their homes. It represents opportunities for advertisers to get in front of them with the right kind of message. I think, honestly, the biggest change that we've had in communicating with patients and caregivers and things like that is the tone that we're trying to reach them with. We had disease awareness campaigns where symptomology overlapped with COVID, and we wanted to pull those off air as soon as possible so that we wouldn't be interfering with somebody searching for or thinking about something that was really life-threatening to them in COVID. We paused keywords that overlapped with COVID symptomology. Our first thought, honestly, was let's make sure we're not getting in the way of anybody that actually needs to find potentially life-saving information in the face of the pandemic. And then we started pivoting to, once we were sure we were taking care of that, we started pivoting to, what are the resources that patients are really looking for in these times, and can we adjust our messaging to give them more value, right? There's always kind of a value exchange when you're asking somebody to engage with a piece of content or an ad that you're putting in front of them. they're spending their time with the brand, and you should be giving them something of value in return. So that's really what we kind of focused on from that point.
Dan, I wanted to ask you about partnering with tech platforms, particularly DSPs, and how that works for you guys, because it's different, right? The data that's available, a lot of HIPAA regulations that you deal with. At a high level, how do you work with a DSP for your healthcare needs, and sort of how does that mix, and what are your expectations, and what are your clients' expectations?
Sure. Our expectations, client expectations, I think first and foremost is brand safety and regulatory compliance. So that's kind of just table stakes for dealing with any DSP. We want to make sure that they're adhering to privacy laws, which, that's a really kind of dynamic thing that we're really heavily invested in right now. They're adhering to privacy laws. They're adhering to HIPAA compliance, like you mentioned. But I think, the application of data in the world of healthcare is not a new thing. We've been dealing with pretty advanced data sets, and there's been pretty large companies at this point that have built their entire business model around making sure that advertisers can apply HIPAA compliant but very healthcare specific data in targeting ads. You think of companies like Crossix that are helping us with measurement, which before companies like that existed, measurement in the healthcare space was a very, very shadowy sort of proposition. But companies like that are also creating targeting models based on actual claims data that we can activate. So it's like everything else. It's a constantly evolving dynamic marketplace, but healthcare, luckily for our clients, healthcare has really invested in creating creating opportunities to use data in a totally compliant way.
Dan, I wanted to ask you about predictive advertising and healthcare and healthcare marketing, and sort of what that means and how you use it, and what results you're expecting around it.
Sure. Yeah. I think that's been one of the toughest challenges to crack as we've been working in healthcare. A lot of the data that we're leveraging is reactive data, right? So we get a signal that somebody was diagnosed with a certain ICD-10 code, or that they filled a prescription for a medication. Those are really strong signals that they should be the recipient of certain type of advertising. On the HCP side of things, we can track physicians at the individual level, and our clients often subscribe to data that allows them to understand exactly what products they're prescribing, in what volume, what the trends are, like that. But again, it's all kind of reactive data. It's reading what's happened in the past and trying to use that to identify the right time or the right format of an ad to serve to somebody. But we're partnering with Deep Intent right now to activate a much more predictive sort of targeting that leverages eligibility data to predict when a patient is going to see one of the physicians that we want to communicate with in the next several weeks. So instead of saying after the patient goes in the office, saying that would have been a good opportunity to get in front of that physician with our brand message, this eligibility data allows us to target that, maybe 2 or 3 week period prior to a patient that we know has a condition that one of our advertisers brands treats, and get in front of that physician such that when the patient gets into the office, we've already communicated with that physician and said, maybe this is something that you want to consider for this patient.
So how widespread is that, and what kind of, I'm not sure, I assume you're not going to name your clients, but what kinds of pharmaceutical marketers are using predictive now?
I think everyone's trying to be predictive. We're definitely one of the first to leverage this eligibility tactic. I can't say exactly which clients we're using it for, but we're piloting it currently, and so far it's going well, and we think that it could be something that's really central to HCP messaging moving forward.
And finally, some thoughts about sort of challenges to healthcare marketing. Kind of what are the opportunities? What are some roadblocks? Where things might be going in the next 12 months. Some thoughts there?
Yeah, I think we're sitting at a really pivotal time right now. Obviously, the big thing that's impacting everything that everyone is doing is the pandemic. And right now, numbers are starting to creep back up. At least where I am, I'm in New Jersey right now, and people are getting concerned that we might be facing a second wave. So I think first and foremost, we want to make sure, like I mentioned before, we're providing value to the folks that we're engaging. We're giving them quality information. We're not standing in the way of them staying up to date on what keeps them safe and healthy. Working in healthcare, first and foremost, we're concerned with the health of the patients that we're trying to communicate with. But the good thing about the type of campaigns that we design is that they're supremely flexible, they're supremely optimizable. Our core philosophy when it comes to managing media is that we follow the data. We never double down on something just because it was a part of the plan from day one. I tell my clients all the time, your media plan looks very different on day 30 than it does on day one. And that's because we don't buy into our own best thinking of a month ago. We want to make sure that we're reacting to what we know today is the reality of the state of our media plans. So, I would love to know what the world's going to look like 12 months from now. I'm sure we all would, but I think, because of that optimization philosophy, we're going to be able to pivot where we need to pivot and make sure that our ads are reaching the right people at the right time.